This is our final lecture on Chapter 10. In this lecture, we will be discussing fitness testing for youth and persons with disabilities. Similarly to older adults, sometimes we need to administer different tests to youth in order to get a better idea of their physical fitness. A lot of the youth fitness tests are created in a test battery where multiple tests are administered as a package. The assessment of physical fitness for youth has shifted from motor fitness to more health-related fitness, and there's a greater emphasis on health-related outcomes. Currently, there are a number of test batteries. However, 3 elements are present in all of them: health-related fitness items, criterion-referenced standards for each test, and some sort of motivational award. This table breaks down 2 different test batteries that are most common. In the left-hand column, we have the FitnessGram, and the right-hand column, we have the EuroFit. If you look, you can see that both tests have implementations for aerobic capacity, body composition, abdominal strength and endurance, upper body strength, flexibility, and power. However, the FitnessGram also takes into account trunk extension strength, whereas the EuroFit looks at running speed and agility, balance, and speed of limb movement. The EuroFit test battery combines health-related and performance-related items into one battery of tests. Additionally, it has motor ability items like plate tapping, power, and balance. The FitnessGram is also a common battery of tests used to assess the fitness of youth. This is the most widely used health-related youth fitness test in the U.S., and this is the test battery that's also used by the Presidential Youth Fitness Program. This program includes optional tests, computer software, and computer software support. The FitnessGram includes health-related criterion reference standards depending on which test you select, such as the healthy risk zone, needs improvement zone, healthy fitness zone for heart health. So these are different categories that one might fit into when examining heart health. And the student report conveys a fitness status that usually goes in that healthy risk, needs improvement, etc. This is an example of a student report for the FitnessGram. As you can see, it breaks down the different test components from heart health, body health, muscle fitness, etc. And then it also provides the raw score for each of those tests, as well as where they fit on that criterion referenced model. So if we look at the heart health, the number 1 under aerobic capacity, this particular individual falls within that need improvement zone, versus in the body health for body mass index, they fall into the health fitness zone. It helps to target where an individual may need specific improvements to improve their overall fitness and physical health. The FitnessGram requires a variety of items. These include the pacer, skin fold measurements, curl-ups, trunk lift, 90-degree push-ups, vertical jump, plank, and hand grip strength. These will be further broken down in the coming slides. One of the components of the FitnessGram is the PACER test, or the Progressive Aerobic Cardiovascular Endurance Run Test. This is also sometimes referred to as the BEEP test. This is something you're all probably at least a little familiar with, but this test measures aerobic capacity, and the student runs as long as possible back and forth across a 20-meter space at a specified pace. This pace increases each minute, and so the patient or the student has to run from one line to the other and then back in between the beeps, and the beep time gets progressively shorter. The recorded score is the total number of laps completed by each participant. The instructions for this test are broken down on the next 2 slides. The next test in the test battery for the fitness gram is skin fold measurements. This is used to measure percent body fat. The procedure for this is very similar to what we've talked about previously in our body composition lecture, as well as our lab. You're going to pinch the skin, use the skin fold calipers, and take 3 measurements at each site. However, when we're looking at youth, we are only going to take measurements at the tricep and the medial calf. For the medial calf, you're going to look for the spot where the calf is the thickest, and for the tricep, it's going to be midpoint between the acromion and the olecranon. Why might we only use these 2 skin fold sites when we're talking about measuring youth? One of the biggest reasons is that we want them to be comfortable, and both the tricep and the calf allow for the patient to just roll up their sleeve or pant leg in order to obtain this measurement. When we're looking at skin folds, each skin fold is measured 3 times, and we're looking for the median value to be recorded to the nearest 0.5 millimeter. This demonstrates the procedure for taking skin fold measurements. The next part of the fitness gram is the curl up test. This test measures abdominal strength and endurance. A student will perform as many curl-ups as possible, up to a maximum of 75. The curl-ups are performed at a rate of 1 curl-up for every 3 seconds, and you need to record the number of curl-ups that the participant or student did. The rest of the specific procedures are on the next slide. The next test is the trunk lift. The trunk lift measures trunk extensor strength and flexibility. The student lies on their stomach with their upper body on the ground, with their arms by their sides, and then they use the muscles of the back and lift their chest off of the ground to allow an accurate measurement from the chin to the ground. The student performs 2 trials, and you record the highest score to the nearest inch, up to a maximum of 12 inches. Again, the rest of the procedures are presented in more detail on the next slide. The next component of the fitness gram is the 90-degree push-up test. This test measures upper body strength and endurance. The student starts laying on their stomach with their elbows bent, and when are instructed to start, push up so their elbows are extended, and then do push-ups where their elbows bend to 90 degrees and continuing to fully extend their arms. The student completes as many push-ups as possible at a rate of 1 push-up every 3 seconds, and one records the number of push-ups performed. The test concludes when form is no longer maintained or the student is unable to perform any more push-ups. The next test in the fitness gram is the vertical jump test. The purpose of this is to estimate bone health by looking at lower body muscular power. The vertical jump will be presented on the next few slides, but you start with the student standing with their arm overhead and making a mark of where they can reach, and then they squat before jumping. They then jump as high as they can and marking where that is, or you can use a Vertec device, and then you're going to measure the difference between their starting position mark and the mark when they jumped. Further instructions are broken down on the next slide. The next test is a plank. We're all pretty familiar with the plank, but this measures core strength and muscular endurance. You're going to time how long the student can maintain this position for a maximum of 3 minutes. The last test in the fitness gram test battery is the hand grip strength. This measures isometric strength. You can use a handheld dynamometer or other grip strength devices in which the patient or athlete grips as hard as they can, and it will provide a reading. Further instructions are on the next slide. The FitnessGram does have a few other components that are more modifications, like the modified pull-up or flexed arm hangs. This slide demonstrates the criterion reference standards for boys based on age in order to be in that healthy fitness zone. The next slide is the same, but for the girls. When we're dealing with children and fitness testing children, we have to have some additional considerations when we're preparing for the test. The first thing is that we need to attain adequate knowledge of the test descriptions and give proper demonstration and instructions. So you, as the person administering the test, have to understand all of the components and be able to break that down so the child knows what they have to do in order to do the test properly. That includes sometimes pictures, demonstrations, and other detailed instructions. Additionally, you need to develop good student and teacher preparation through adequate practice trials. This is one of the most important things. Doing practice trials, especially for youth, will allow you to obtain more accurate data. One specific example of this might be the vertical jump test. They might need a practice trial in order to get the sequencing correct so that you can get a good, valid measurement. Additionally, having them complete a couple push-ups or curl-ups before you start counting also is helpful so that they understand the rhythm in which they need to complete the curl up and the push up so that, again, you can get reliable data. And lastly, you want to be able to conduct reliability studies with the data that is obtained. When we're looking at youth fitness tests, not all tests are created equal. Distance runs and skin folds have the best criterion related validity within the research. Tests like muscular fitness, pull-ups, push-ups, modified pull-ups, sit-ups, curl-ups, etc. have limited criterion-related validity, but are accepted on content or logical validity, which is a lower level of evidence, but it doesn't mean that it's not valid. We can also have poor reliability in field tests in children. The younger the child is, the less reliable the data is. A lot of that has to do with attention span and also the ability to follow directions appropriately. There are specific considerations that we needed to take into account when administering fitness testing to youth. Similarly, there are additional considerations to take into account when completing fitness testing for special populations. Special populations include people with physical or mental disabilities or both. Valid and reliable fitness assessment of people with disabilities is not a well-researched or well-understood topic, and there's definitely a gap in the literature. We do know that when we're looking at assessing people that fall into the special populations category, we want to make sure the fitness assessment should include anaerobic power, aerobic capacity, electrocardiographic response to exercise, muscular fitness, which can include strength, endurance, or flexibility, and body composition. When assessing this population, it's appropriate to find fitness assessments that require accurate classification of the person's disability, as well as proper test and protocol selection is important based on the conditions that this specific person has. It's important that we have specific training and education that's required for fitness measurements, and reliability and validity for specific conditions is needed. When we're looking to conduct fitness testing on children with disabilities, we have even more considerations to take into account. We know that traditional fitness test batteries are biased against children with physical or mental disabilities. Most of the criterion data is set based on what are quote unquote healthy norms. So a child with a disability might not be able to appropriately use criterion reference data. We must consider the participants' limitations, mental capacities, interfering reflexes, and acquisition of prerequisite functions when we're trying to select appropriate tests for children with disabilities. One of the test batteries is the Brockport Physical Fitness Test. This was funded by the U.S. Department of Education, and it was developed for youth with various disabilities between the age of 10 and 17, and also includes criterion reference standards for 25 different tests. The Brockport Physical Fitness Test does offer a test kit that includes a manual, demonstration videos, fitness training guides, as well as software in order to most appropriately be administered. In summary, various factors are involved in assessing health-related fitness, reliability, and validity. Mastering the material does not necessarily make you qualified to administer testing in all populations or situations, but it is an important step. Lastly, health-related fitness testing, as with any other testing situation, requires appropriate test selection, preparation, practice trials, and attention to detail for sound measurement and evaluation of performance. Here are some review questions.